Have you ever felt unusually thirsty, tired, or noticed your vision getting blurry? You might think it's just stress, aging, or dehydration, but these could actually be early warning signs that your blood sugar is dangerously high. High blood sugar, also called hyperglycemia, often develops quietly. Many people don't notice the damage until it's too late, and by then, type 2 diabetes or other complications may have already set in. In this video, we're going to walk through 16 alarming signs your blood sugar is too high and 8 early diabetes symptoms you must never ignore. By the end, you'll know exactly what to look for, what's normal, and when to take action. Part 1 - 16 alarming signs of high blood sugar. 1. Constant thirst, polydipsia. When your blood sugar rises, your body tries to flush out the excess glucose through urine. This process draws water from your tissues, leaving you dehydrated. That's why you might feel thirsty all the time, even right after drinking water. If you find yourself refilling your glass constantly and still feeling dry-mouthed, it's a sign you shouldn't ignore. 2. Frequent urination, polyuria. This is one of the most classic symptoms. Excess sugar in your blood makes your kidneys work overtime to filter and remove it, which leads to more trips to the bathroom, especially at night. If you're waking up multiple times to urinate, your blood sugar could be the culprit. 3. Blurred vision. High glucose levels cause swelling in the lenses of your eyes, making it harder for them to focus. Sometimes this blurred vision comes and goes, which makes people think it's just temporary eye strain. But if it happens repeatedly, it's worth getting your blood sugar checked. 4. Fatigue and weakness. Glucose is your body's main source of energy, but when it can't enter your cells due to insulin resistance or lack of insulin, your body runs low on fuel. The result? Constant fatigue, even after a full night's sleep. 5. Slow healing wounds and cuts. High blood sugar damages blood vessels and impairs circulation, slowing the delivery of nutrients needed for healing. If cuts, scrapes, or bruises are taking unusually long to heal, it's a red flag. 6. Unexplained weight loss. While many associate high blood sugar with weight gain, some people actually lose weight rapidly. This happens because your body starts breaking down muscle and fat for energy when it can't access glucose properly. 7. Increased hunger, polyphagia. When glucose can't get into your cells, your body thinks it's starving, so it signals hunger even after eating. This can lead to overeating and further blood sugar spikes. 8. Tingling or numbness in hands and feet. Persistently high blood sugar can damage nerves, leading to a condition called peripheral neuropathy. This often starts with tingling, burning, or numbness in the extremities. 9. Recurring infections. High blood sugar weakens your immune system, making you more prone to infections, especially urinary tract infections, skin infections, and gum disease. 10. Dry mouth and skin. Excessive urination and dehydration often lead to dryness. If your lips are chapped, your skin feels rough, or your mouth feels sticky, your blood sugar might be involved. 11. Frequent headaches. Rapid changes in blood sugar, especially spikes and drops, can trigger headaches. If they happen often without an obvious cause, it's worth checking your glucose levels. 12. Mood changes and irritability. Blood sugar impacts brain function. Sudden spikes or drops can cause mood swings, irritability, or even feelings of anxiety. 13. Swollen or bleeding gums. High sugar levels can encourage bacterial growth in the mouth, leading to gum inflammation and bleeding when brushing or flossing. 14. Trouble concentrating. When your brain cells can't get enough glucose, your mental sharpness suffers. People often describe this as brain fog. 15. Dark patches on the skin, acanthosis nigricans. These velvety, darkened patches often appear on the neck, armpits, or groin. They're a sign of insulin resistance. 16. Nausea and vomiting. In severe cases, high blood sugar can lead to diabetic ketoacidosis (DSK), which causes nausea, vomiting, and abdominal pain. This is a medical emergency. Part 2-8 Early diabetes symptoms. Now, while high blood sugar can occur temporarily, such as after a big meal, persistent symptoms can indicate type 2 diabetes or prediabetes. Let's go through the 8 most important early signs. 1. Persistent fatigue. While we mentioned fatigue earlier, in diabetes it's often more intense and long-lasting because your body simply cannot use glucose properly over a prolonged period. 2. Frequent infections. Diabetes reduces the body's ability to fight germs. Yeast infections, urinary tract infections, and skin infections become more common and harder to treat. 3. Unexplained weight changes. Both weight loss and weight gain can be early diabetes signs, depending on how your body responds to high insulin or insulin resistance. 4. Blurred or fluctuating vision. Diabetes-related eye changes can happen suddenly and may improve or worsen depending on your blood sugar at the moment. 4. Blurred or fluctuating vision. Diabetes-related eye changes can happen suddenly and may improve or worsen depending on your blood sugar at the moment. 5. Tingling or loss of sensation. This nerve damage, called diabetic neuropathy, often starts subtly but can become permanent if ignored. 6. Excessive thirst and urination. These hallmark signs show up because your kidneys are trying to get rid of excess glucose. 7. Slow healing of wounds. Cuts, blisters, and sores may linger for weeks or even months in undiagnosed diabetes. 8. Changes in skin color or texture. In addition to acanthosis nigricans, diabetes can cause shin spots, redness, or even thickened skin on the hands and feet. Part 3. Why these signs matter. High blood sugar isn't just about feeling uncomfortable over time. It can damage almost every organ in your body. It increases the risk of heart disease, stroke, kidney failure, nerve damage, and blindness. The earlier you notice and address these symptoms, the better your chances of preventing permanent complications. Part 4. When to seek medical help. You should see a healthcare provider immediately if your symptoms are severe or worsening, you experience vomiting, confusion, or rapid breathing, possible DSK. Your vision changes dramatically. You have wounds that aren't healing. Doctors can perform simple blood tests like fasting glucose, A1C, and glucose tolerance tests to confirm whether you have high blood sugar or diabetes. Part 5. How to take control naturally. While only a healthcare provider can diagnose or treat you, here are some evidence-based ways to manage blood sugar naturally. Choose low glycemic foods. Focus on vegetables, lean proteins, whole grains, nuts, and seeds. Stay active. Even a 20-30 minute walk after meals can help lower blood sugar. Stay hydrated. Water helps your kidneys flush excess glucose. Manage stress. Stress hormones can raise blood sugar, so activities like meditation, deep breathing, or light yoga help. Get quality sleep. Poor sleep affects insulin sensitivity. Limit sugary and processed foods. Reduce soda, candy, white bread, and fried snacks. High blood sugar can be silent, but your body often sends out warning signs. The key is to notice them early and take action before serious damage occurs. If you've recognized any of these 16 high blood sugar signs or a diabetes symptoms in yourself or a loved one, don't ignore them. Make an appointment with your doctor and get tested. Your health is your greatest wealth, and awareness is the first step toward protection. If you found this video helpful, make sure to like, share, and subscribe for more life-saving health tips. And remember, taking small steps today can prevent big problems tomorrow.